This video will explain domestic violence, or DV. Domestic violence means when one person causes harm to another person who bears with being treated poorly. This happens between two people in a close relationship, like a married couple or a dating couple. It could be two friends or related family members, parents, brothers and sisters, aunts and uncles, etc. Domestic violence can occur at any time, anywhere, to anyone. Age doesn't matter, young or old. Domestic violence happens to people of any race, any income level, rich, poor, anyone. Anyone can be responsible for domestic violence. There are many domestic violence behaviors that can hurt someone. It can be physical harm, emotional, or sexual. Domestic violence occurs because the abuser wants power and control. Forms of control include physical, verbal, and financial. These can happen separately or at the same time, or there could just be one type of control the abuser uses. Domestic violence doesn't just happen one time, it recurs. It can also become worse and worse over time. The physical abuse can become more and more dangerous. The person being abused can feel more agitated and more unsafe over time. After an episode of abuse, the abuser who caused harm may apologize, say it was a mistake, and promise that it will never happen again, but it will occur again and again. The abuser may blame the person they hurt and tell them it's their fault that it happened. That's called victim blaming. This may confuse the person being hurt, and they may actually question themselves and think it's true. Did I cause the problem? Maybe it was my fault. Domestic violence is never the survivor's fault. It is always the abuser who chose to behave that way. I want to explain more about the types of domestic violence: physical, emotional, and sexual. There are three types of domestic violence abuse: physical abuse, emotional abuse, and sexual abuse. I'll explain all three. Physical abuse can mean the abuser uses their hands or objects to hurt someone. Examples of this include punching, slapping, scratching, pushing or shoving, kicking, biting, choking, throwing things at their partner. Any of these actions are meant to hurt you. A person who has experienced any of these may have burn marks, scars or teeth marks. There may be bruises on different parts of the body. There may be pains in different parts of the body, including arms, legs, penis, vagina. The pains may feel strange and cause a person trouble moving around. The injured person's clothes may be torn and stained with blood. Their underwear may be torn and stained with blood. Other people may notice that something doesn't seem right. The person who's been abused may explain the bruises by saying that they slipped and fell, but other people notice that the story doesn't make sense and they suspect that something's wrong. The survivor may try to cover up the abuse by making up a story about what happened, or maybe they can't explain and can't answer questions at all. The abuser may try to physically harm in a place that's easy to hide, such as on the back or stomach, places others can't see because clothing covers it up. The abuse stays hidden this way. Abuse is not love. It is violence. Now that we've discussed physical abuse, we'll take a look at what emotional abuse means. Now let's talk about emotional abuse. Emotional abuse includes insults, brainwashing, trying to control the other person, not allowing the partner to do things. The abusive partner continually criticizes, belittles, and insults every day. The abused person struggles with feeling anxious and uncomfortable. The abused person may have been positive and happy before. Everything was fine. Now they change and feel isolated, ashamed, that they're no good and worthless. Verbal abuse, such as threats and insults, count as emotional abuse. Here are some examples of emotional abuse. The abusive partner insults you. You feel less important than the abuser. The abuser discounts you. The abuser ignores their partner and doesn't show love. There's no affection or attention. The abuser mocks their partner. The abuser may butter up their partner to brainwash and control them. They may ask the partner, "Where did you go? What were you doing?" They want to control their partner's activities all of the time. The abuser will tell their partner they can't do fun things that they used to enjoy, and they can't see friends anymore. The abuser keeps their partner under their control. Relationships with family and friends are lost. The abuser has control of the money, and this means the partner has no money of their own. They become financially dependent. If the partner says they will leave, the abuser may say, "If you leave me, I'll kill myself," or "I'll hurt myself." And then the abused partner feels stuck. After going through the emotional abuse, including threats and control, the person being abused may feel afraid of the abuser. The victim may get used to and accept the insults, threats, and being hurt, and believe it really is their fault and that they deserve it. But it's not true. They may feel stuck and not know where to go to find resources for help. They feel they're always wrong and can never satisfy the abusive partner no matter what they do. It doesn't matter. It will never be good enough. They work hard to make sure the abuser doesn't become angry and lose their temper. They act obedient and feel that they must be careful at all times. It's all right for the abusive partner to go out and have fun, but the partner being controlled needs permission to do the same. These are some examples of emotional abuse. Emotional abuse is not love, it is violence. The third kind of abuse is sexual abuse. Sexual abuse means forcing a person to do things related to having sex. The survivor has not yet agreed and doesn't want to have sex. They haven't given consent, but they feel stuck. Sexual abuse can happen to anyone. It happens to men, women, people with any gender identity. It can occur between same-sex couples, straight couples, transgender couples. It can happen to anyone. Here are examples of sexual abuse. Unwanted touching of your body, forced kissing, unwanted touching of breasts, penis, vagina, or buttocks. There may be physical violence if the partner won't do what the abuser wants. They may force anal sex, oral sex, vaginal sex, and the abused partner has to go along with it. The abuser may order the partner to take off all of their clothes, and they would have no choice. They would have to become nude. The abuser may take photographs or video of the partner, and then they may post that on the internet on porn sites. The abuser may expose their penis or vagina to the victim. The abuser may force their partner to look at porn, pictures, or videos, even if they don't want to. The abuser may talk about sex in disgusting ways the partner doesn't like. The abuser may force their partner to have sex with other people in order to earn money for the abuser. This means the abuser is forcing their partner to become a sex slave. Someone who's been sexually abused may have trouble sleeping. They may have bad dreams all of the time. Other people may notice that when the abuser enters a room, the partner seems afraid and leaves. The abused partner may start to deteriorate, become more and more depressed. They may become more scared, anxious, and nervous. A person who was happy, liked going out and doing fun things, starts to change. They don't go out anymore, and they withdraw from activities they used to enjoy. They disengage from life in many ways. Their clothes may be torn, stained, or have blood spots. Their underwear may be ripped, stained, or have blood spots. Areas around the breasts, vagina, penis, or anus may be painful and bruised. There may be scratches. The survivor may get an STD, a sexually transmitted disease, or infection from their abuser. They may start thinking and talking about suicide. Sexual abuse is not love. It is violence. Now I have explained all three forms of abuse. What do you do if you notice someone who may be being abused? If you suspect a friend or loved one, a family member, or anyone who may be experiencing any of the three types of abuse, how can you help? You could tell them that you know they are being abused and that it's not their fault. Let them know that you're there for them to talk to about their feelings, in person or through VP, so that you can give them support. Respect their choices about this. There are many reasons someone may stay in a relationship with a partner who is an abuser. They may leave and then go back. That is their choice. You need to be understanding, compassionate, and accepting of their choice. Give them positive messages. Encourage them to go out and be with friends and family. You can help them develop a safety plan. Talk through where they can go if things feel dangerous. Talk about friends, family members, shelters, or safe houses they can go to. You can discuss how they will get there. Tell them to make sure they have cash and important papers ready if they decide to leave. Explain that there are people ready to help them at local shelters and agencies. You could offer to go with them to help connect them to services. If you've been abused, what do you do after leaving the hospital or the doctor? The doctor may have given you medicine to help reduce pain or prevent and/or heal infection. Or medicine to help with anxiety and nervousness. If you wonder about limiting physical activities, it depends. If the abuse hurt your body and you have trouble moving, you need to rest until your pain resolves. If you are seriously hurt and you need medicine, stitches, or other care, contact your doctor or go to the ER. Trauma shows up in many ways. You may have traumatic memories of the abuse, which causes fear and stress, nervousness, anxiety, depression. You may have bruises and other injuries from the abuse, maybe on your penis, vagina, or anus. Or you may have infections or bleeding. Your mood may get worse. You might avoid family and friends, and you don't want to be social, and you stay away. You may not be motivated to do very much. You may have thoughts of hurting yourself. You may have low self-esteem. You may attempt to kill yourself, commit suicide. All of these are symptoms of trauma that can occur. Here are some things to keep in mind. This is important for you or your children who've experienced abuse. You and your children need to be safe. Go to a safe place, a family member or friend's house. Domestic violence agencies in your area may have safe houses or shelters. Go there or call 911. If you plan to escape, bring important things with you, like keys, money, ID, important documents, etc. You can go to counseling. There are support groups with other people who've gone through abuse themselves. Maybe they can help you through this experience and help you cope with the situation. Some of them have successfully come out the other side and can keep you positive and focused on the future. You can benefit from that group support. If you need more information, it will be shown on the next screen. It's important for you to understand and recognize that domestic violence is not your fault. Domestic violence is not love. Here are more resources.